Welcome, ladies, to another Living Life Naturally podcast. So excited to have you here. As always, I want to remind you that if you go to my website in the show notes below, you'll find your opportunity for a free call with me or my free offer for 5 essential steps for flourishing in menopause. So our audience is mainly made up, as you know, of women who are in midlife. So I'm very thrilled today to have somebody who can speak specifically to one of those areas for us. And that is Valerie Cacho, MD. She is an integrative sleep medicine physician, and she's a woman's sleep expert. Her interests and expertise actually include diagnosing and treating medical sleep disorders, mind-body approaches to insomnia, self-compassion, and mindfulness, clinical hypnotherapy, and then promoting sleep health and whole living. She's the president and founder of Sleep Life Med, a tele-sleep practice in both Hawaii and California. And Dr. Cacho is also CEO of Sleephoria, a sleep health resource for women founded on the belief that a well-rested woman has the energy, clarity, and drive to change the world. So true. So we're so excited to have you here, Valerie. Welcome.
Thank you, Lynn. My pleasure to be here and talk about sleep with your community.
Yes, so it's such a huge topic for women who are especially in midlife, menopause, perimenopause, because we have so many different sleep patterns with hot flashes, just with bad quality sleep. And so let's discuss some of those. But before we get going, please give me a little background. Tell our listeners a little something about you and who you are and why you do what you do.
Oh, great. Yeah. So where should I begin? I would say probably back to childhood is where a lot of things start. I grew up in a medical family. My mom is a registered nurse and my dad is a cardiologist. And he did not sleep very much because he did interventional cardiology and office work. So I think today it's divided up, but he would leave the house in the middle of the night. Someone's having an acute heart attack, rush to the hospital. So I didn't see him quite that often. So I knew I didn't want to have that lifestyle because, I think maybe at a young age, I knew that sleep was important. But then as I went through my training, as I went through medical school, they almost don't really allow you to sleep very much. I remember staying up all night and probably just sort of out of my own volition with some of my friends just studying. We'd pull all-nighters and then just sort of like dozing off during some of my tests, which, knowing what I know now, I don't know how I did that. And then through training, right? I was part of the training period where we would stay up for over 30 hours. And so, the rules and the laws are a lot better now that really protect your sleep. And it really wasn't until I was working at my hospital position in Hawaii. I was a medical director of a huge sleep lab there. And there was a lot of women coming to me to really make sure that we did or didn't have sleep apnea. And certainly a lot of folks did, but the ones that didn't, I was just scratching my head. And, really at that time, I didn't really have the opportunity to dig deeper into learning more about the hormones, because really day and day, it was just reading sleep studies, putting on people on CPAP machines. So I knew there was something more to this, that, sleep apnea did have its role, but there was something about the hormones. There was something about the palpitations I was hearing, something about just being a light sleeper. And then when I started my own private practice, just throughout the pandemic, I really dug deeper into the science of why this is happening. And then really just started talking to other women, being on podcasts and putting some material out there about what potentially can be happening. And it's pretty great because a lot of people are resonating with it. And I love helping people feel better, and what not way to do so by then getting better sleep. Yeah, so that's just a little about me. So my own struggles with sleep, seeing a lot of people, and then coming up with just ways that we can support each other. And I think really that's what life is about, building relationships and just sharing the knowledge and experience we have.
So give us some ideas about holistic ways to sleep better when you're suffering from insomnia during that menopause, perimenopausal period.
Yeah, I love this question, Lynn. So I like to think of it from the whole mind, body, and soul approach, right? When we think holistically, we're not just focusing in on one specific thing, right? Certainly, hormone fluctuations can play a role, specifically estrogen and progesterone, and that's the body part. So maybe I'll start with the body. So as we go through the transition where our bodies and Mother Nature, Father Time decide that we don't need to have babies anymore, what happens? Well, our estrogen levels can drop. They actually fluctuate up until we go without a period, then the levels are really low. And then progesterone does the same because we don't need to support life. When our estrogen levels drop, we have a lot more hot flashes. And also when our progesterone levels drop, progesterone from a chemical standpoint is quite similar to things like the anti-anxiety medications that we use, the benzodiazepines, some of the sleeping pills. And so when we have less of those signals going through our bodies, guess what? We can be lighter sleepers, right? We can have more hot flashes. And when we don't sleep well, guess what? It also sets off the mind part, which is, more anxiety, more depression, potentially some ruminating thoughts. So again, the mind, body, and soul. So what happens with sleep is when our brain waves slow down. So if there's something on our mind, or if we're worried about our health, if we're just anticipating another hot flash to come, right? That can precipitate, some insomnia as well. Going back to the body part, I did talk about how I used to work as a, medical director of a sleep lab. A lot of women could have sleep apnea and don't have the classic symptoms. So we know from some of the research studies, a little bit older studies, that up to 90% of women who potentially have sleep apnea aren't even diagnosed. And the reason for this is just like, perimenopause and menopause, doctors aren't trained in sleep medicine. And so we do get maybe a lecture here or there, but up to 40% of women who potentially have disordered breathing when they sleep don't snore, gasp, or choke for air. What women can present with is insomnia, maybe more vivid dreams, headaches in the morning, fatigued, and some emotional disturbances. And then if your doctor hears that, they'll probably say, oh, you're just a busy mom, or you're just working a lot, or you're taking care of your parents, or maybe it's your thyroid. Let's go check that. Or you could be anemic, right? Certainly there's a lot of overlap between psychosocial and other, medical conditions. But what I love about treating sleep apnea, it's quite easy to diagnose. You can do a home test in the comfort of your own home. You don't have to go to the lab. And then there are a lot of good treatment options that can help you feel better. So that's the body part. And then going on to the soul part, as we get older, sometimes our relationships aren't quite where they need to be. I've worked with people who have insomnia and they've been married for years, but they don't really connect with their partner or their spouse, and they're almost like two moving ships in the same space, and they feel quite lonely. So that may be one thing. Another thing too is from a career standpoint. Maybe you've been in the same job for the last 30, 20, 30, 40 years. And now you're thinking about maybe retiring, or maybe, working part-time, or starting a whole new business venture altogether, right? A lot of us have side hustles and side things that are really our passion projects, and wondering if we can make something of that. And you can see how the literature, in terms of when we do studies in women prior to 1994, women weren't even required to be included because it's so complex, right? It would like muddy the results. So let's just not include women. Let's just not study them, which really does, us a lot of disservice. So really from that holistic standpoint, I have this really robust questionnaire where we're talking about, okay, what's keeping you from sleeping? Is it stress, anxiety? Is it hormonal fluctuations? Are you having hot flashes? Are you snoring? Are you kicking your legs? Are you having pain that's keeping you from sleeping? Or are you just getting hot? And then the soul part, what's going on with your relationships? How is your career? And so it's really the amalgamation of all those things that can contribute to someone's insomnia, which sort of I get a little bit irritated when, irritated in the sense, well, people just don't know they don't know, but, I'm part of different, menopause groups, and it's just like, I can't sleep. And it's like, take THC, take magnesium. And I'm like, yeah, those things may help you feel drowsy. But if you're in a broken relationship, magnesium ain't going to do a thing, right? We need to have these conversations of what is really going on. And then we can, focus on the healing, be part of the journey. But sometimes it really just takes a lot of self-introspection, trying to figure out what is happening.
Right. That's funny you should say that because I had a conversation on a podcast I was a guest on yesterday
Oh, okay.
about we have so many things going on, but we
Right.
don't do that introspection work. We
Yeah.
don't think about what is it that's making me do this? And that can especially relate to things like your nutrition, and that can
Oh,
have an effect on sleep and
oh,
emotions
100%.
and so many
Yeah.
things, but we don't ask ourselves why, or we don't dive into the nitty-gritty of what is it, what's the root cause here, so that I can get a better result when I start changing. It's what I love
Yeah.
about journaling because it can really give you some aha moments.
Yeah, I'm a big fan of journaling. I have mine here, and I like to do just a couple minutes in the morning. Sometimes when you think of journaling, we think of, okay, it has to be this whole big process, 15, 20 minutes, 3 to 5 pages. If you have the time for that, excellent.
Yeah.
Sometimes, if I have 2 minutes, I'm just going to scribble, okay, these are my intentions for the day, what a win would look like today, and maybe something I'm grateful for. And that's it. And sometimes,
Mm.
that's all it takes. But yeah, journaling is one of the best ways I have found for helping those of us who have that very busy mind, right? And that can keep us from
Yes.
sleeping, those ruminating
Yes.
thoughts, thinking about potentially what could happen. And it's just like, give your brain that time and space to be, meaning,
Mm.
I think of that busy mind at night as a puppy dog chasing its tail, and it's going
Yeah.
around and around and
Yeah.
around. And it's okay that your brain is going to do that. It's just not so helpful if it's doing it at 10, 11, 12, 1 o'clock, 2 o'clock at night. Set aside
Right.
a time during the day. Yeah. And then when it wants to be busy at night, you can tell your brain, like, okay, I know you want to do this, but guess what? We have some scheduled time tomorrow. So it's okay to rest right now. And it sounds like a little bit funny how simplistic that could be, but it really works because I'm sure, as you know, Lynn, we have this relaxation part of our brain. We have the autonomic nervous system, right? It has that sympathetic drive, that stress response, a bus is coming at us. We have a deadline for work. We want to be able to get into action and go. And then we have that relaxation phase. And I think that's the part that we don't always think about, right? We're sort of go, go, go. We overschedule ourselves. And then by the time we put our head on the pillow, we just expect to be asleep. But just like driving a car, right? You got to slow down. You got to put into reverse and then park to be able to be still. I actually heard this on a podcast and talking about insomnia. And it's just like, can you park a car going 70 miles an hour? Of course not. But the problem I see just working with folks and with my own life and, personally is that if we don't give ourselves time to downshift, right? Talking about manual cars, right? We have to, go into the lower gear, and it's okay to do so. Because I think a lot of us are just very overly ambitious, and then probably social media plays a role. Maybe we tend to compare ourselves, just maybe from my own experience, but take that time to go outside, go on that 5 minute walk, smell the flowers, check out how blue the sky can be, and, say hello to your neighbors. It's just a different way to be and move in life. If it's okay to slow down, so give yourself permission to do so. And it's almost necessary, especially if you have a hard time sleeping because your brain is just going and going and going.
Right.
Yeah.
Right. Now, you also talk about things like yoga, therapeutic massage, different modalities of treatment for insomnia. Can you talk about that a little bit?
Yeah. So essentially, what happens when we sleep, right? If I brought you to a sleep lab and you put the EEG leads, we're looking at your brain waves, right? We're trying to see how fast or how slow your brain waves are going. And this can be something that can keep you from falling asleep, but also those 2, 3 a.m. awakenings to help keep you asleep, right? Because sometimes as we sleep, typically after 4 or 5 hours, we're not as tired. And so if
Mm.
our brain's going to start going, it's going to be hard to wind it back down. So yoga is quite excellent. I would say more of the hatha, gentle type yoga. It really connects your brain to your breath and your body, learning to slow down. It's one of those downshifting type
Mm.
practices. And also, it's really good to move move your body. There was a gal on Instagram that I just saw, and her whole feed is all about yoga for sleep or yoga for
Mm,
relaxation. And so some of us who are quite exhausted at the end of the busy day, we don't want to go sign up for a yoga class, or we don't want
mm,
to exercise or even go outside to walk. And so a really good practice that has been shown to actually relax us and calm down our nervous system is a practice we call legs up the wall. So you're lying on flat on your back, your legs up against the wall, or if that's too much, you can just put them on a chair. Yeah, and just have your legs folded over a chair. And being in that position, noticing your breath will help slow down those brain waves. So
mm,
that's something. Another thing is, yeah, massage is really helpful. I think just that healing touch. I know in like Ayurvedic medicine, there's a ritual where you have special oils and you can massage yourself, or you could do it with friends, or even go to masseuse. Because I think that's one of the things, right? If you go to a masseuse for a massage, you're not going to be on your phone. You're not going to be checking your
mhm,
emails. You're
mhm.
pretty much you're forcing yourself to lay there, and hopefully it's a calming experience. Because sometimes we do carry a lot of tension, a lot of stress in our bodies, and sometimes we don't realize this, right? Sometimes you're talking to someone and their shoulders are up to their ears, and they say, "I'm not stressed," but it's again, right, not having that self introspection, right? Not knowing that if we're in front of the computer for 8 hours a day, our shoulders are going to have some knots because we didn't really stretch them out.
Right,
And
right.
so again, having somebody touch that, realizing where those tension points are, helping you release it, right? When you can release any tension in the body, it can also help release tension in your mind. And that's
Mm,
what helps with sleep, right? Releasing that tension, being more calm, being more at peace, and feeling comfortable.
mm. I know relaxation is a huge part of it. And when I first went to a medical clinic in
Mm.
Tampa for my migraines,
Mm.
they did it all holistically,
Oh,
and
fantastic.
it was fantastic. And they gave us recommendations on apps to do. And so until I was able to do it on my own, I would do
Yeah.
one that you think about the tension in your body from the top of the head to
Mm.
the tips of your toes, and you
Yes.
learn how to kind of move it out. And
Yeah.
it's so simple, but yet so
Hmm.
effective for it helped me with migraines, but it also helped me with my sleep.
Yeah, that's
And
phenomenal.
yeah, you can do a short, a medium, a long. If I did a long
Hmm.
one, I'd fall asleep while it was
I love it.
playing. But
And I
yeah,
love it because there's no side effects, right? I mean,
right.
maybe you have a fee for the app, but I feel like a lot of us are reaching for that magical pill, that silver bullet. And there are things that certainly can help. But again, if you can address that underlying issue, right? Releasing
Right,
tension in your
right.
body, letting go of things that aren't serving you anymore, especially at night. Yeah, it can be truly healing to improve sleep.
Mm,
I'm glad you found some help with
mm,
that, migraines. Yeah.
yeah. So is it true that women need less sleep than men?
I love this question. I don't know who came up with it, probably a man. So there was this research study that looked at over 4.4 million people in
Wow.
over 30 countries. And they looked at 14 different health outcomes, things like increased risk for stroke, high blood pressure, cancer, dementia, obesity. Nope. The gender differences were the same.
Mm,
And it depends on what age group you're looking at. So, certainly, a young mother who's just had a baby is going to get less sleep. And then, if you're a caregiver for elderly parents, right, you're going to get less sleep. But in terms of the sleep duration, as far as the current literature, it's the same whether or not you are a man or a female. Um, it's 7 to 8 hours. Yeah. So if you're above 18, the recommended amount is 7 to 8 hours. The question is if we're getting that amount of sleep, and then what happens as we get older when we do develop more health issues, and then maybe we're placed on medications that can also
mm,
disrupt your sleep. Yeah.
right.
So it
Mm,
technically is the same.
mm. And are there some other myths out there about sleep?
Mhm. Yeah, other myths about sleep is that Oh, what's something I saw on Instagram recently? If you have mild sleep apnea, you don't have to treat it because it's just mild. I myself have mild sleep apnea. So we alluded to this before, but for those of us who aren't familiar with this condition, obstructive sleep apnea happens when the muscles of the upper airway, the tongue narrow and collapse, and you can snore, gasp, and choke. Like I said, women don't have these typical symptoms. But if you have a hard time staying asleep or you're waking up unrefreshed, for me, actually, it was headaches in the morning and I was drinking like up to 3 cups of coffee a day and still feeling tired. I was working in the hospital, so it was a pretty busy job. My daughter was about a year old. So I was just thinking, oh, it was just that. And then once my husband said I was snoring, I was thinking like, uh-oh. And I was thinking like, this is my job, right? Every day I would help someone get better sleep by, diagnosing and treating sleep apnea. And I was thinking, nah, I'm too young for that. Or maybe when I'm in menopause, I'm going to have it. But it does run in my family. And so I did my own testing. Lo and behold, I had it. And it wasn't like night or day. It took getting used to having the mask on my face, but definitely felt like my battery was lasting longer. That sometimes that dip after lunch, we get a little bit sleepy. I could last longer. The headaches pretty much went away. So it was really helpful. So mild sleep apnea, if you do have that diagnosis, do go ahead and see if you can get treated for that. Another sleep myth that I hear often is, well, let's talk about like blue light, blue light, avoiding
Yes.
screens. And it's really controversial. So, you know, there's so many things I can tell you about that, but I would say the way light impacts our sleep, it has to do with our circadian rhythm or our internal clock. And that's based on light, darkness, and then melatonin. So if you think about how the natural environment, how nature has it, right? Sun comes up in the morning, our melatonin, which is a natural hormone that's released in the darkness, goes away, and that helps make us feel more awake. And so it is really helpful to have a lot of sunlight during the daytime because that helps us feel awake and also sets us up to sleep better at night, right? We do ideally want to avoid too much bright light in the evening time, about an hour, depending on, how sleepy you are, because too much light can fragment your sleep or disrupt your sleep or delay that release of melatonin. And one caveat to have is, when I'm talking and giving education around sleep health, think about what bucket are you in. So if you're seeing me in my medical practice, you probably have insomnia, right? Or a sleep condition. Or, if you're listening to me on a podcast and you just found it interesting, maybe you're in the worried well. And then there's another category of like the people who want to optimize their sleep. And so I always like to think about, where are you along this pathway? And I can tell you folks with insomnia are very good about their sleep hygiene. They're avoiding blue light and they still can't sleep, which tells me it's more than just the light that can impact it. So yes, it can play a role, but if you avoid it and you still can't sleep, it probably means that there's something else going on there. Maybe there's anxiety that hasn't been dealt with yet, or maybe you have an underlying sleep condition. So just think about yourself along that spectrum. And sometimes when you hear things, is it applicable to you? So that's something to talk about. I do want to talk about, nutrition and the food that we eat, because I think, we all know about caffeine and alcohol and how that can impact our sleep. I think there's enough information out there about that. But I don't think we often talk much about how maybe having high fiber, right, as the last meal, or avoiding cookies and milk. And I don't know how that came because cookies and milk, maybe milk does have some sleep promoting properties to it, but also has high sugar. And so if you do have a hard time, staying asleep, I know personally, if we eat out at a restaurant, because typically, when you go out, the food is a lot saltier. And then if you wake up in the middle of the night just parched, and that's typically not the way that I eat, that could be really disruptive. So salty foods. And another one is actually more processed foods and even desserts. I can speak for this myself, sometimes in the summertime going out to eat ice cream, I noticed that my sleep quality isn't as good, right? When you have high sugar loads, guess what? Your insulin level is going to kick in because you just want, you have to have too much high sugar. But it's almost like your body has to work harder to break those sugars down, and that can lead to less deep sleep and more light sleep. And that's things we've seen in the lab. So yes, caffeine and alcohol can affect your sleep, but also look at foods that are quite salty and foods that have like high sugar content or processed foods, because those are the sneaky things, right? I think that we mentioned that we don't do that self-introspection. Sometimes we have a busy day at work, we're stressed out, we're going to have our wine and chocolate because that makes us feel good, but we may not know some of the underlying potential consequences, how this can be a sleep disruptor. Yeah, so that's something that I like to talk about as well. Yeah.
Of course, I love to talk about nutrition. So I believe there are some even sleep-friendly foods that you can.
Yeah, kiwis. I don't have you heard the research on kiwis? It's pretty interesting. So this is done in Taiwan, where you just had 2 kiwi fruit, I think, an hour before your bedtime. People fell asleep faster, slept longer, had less awakenings, which is really cool. Because if you think about, sort of the building blocks to melatonin, right? Tryptophan, how do we get that? Magnesium can help support the sleep. How do we get that? Well, like fruits and vegetables. So if you get it naturally from fruits and vegetables that you're eating, it can support the sleep. Another one that sort of from the athlete world is tart cherry juice.
Yes.
So people who have a lot of inflammation, like muscle aches and pains, can drink that. Pretty phenomenal. Some of the studies where we've done studies in the lab, just drinking 2 cups of tart cherry juice, one in the morning, one in the evening, slept about like an hour longer from the EEG leads. Really small studies, I think less than 20 people, but it's like, wow, that's phenomenal. That's better than like some of the research on melatonin, even some of the research on sleeping pills. They say on average that can increase your sleep time by about 20 minutes. So yeah, these things certainly can help, but remember, what bucket are you? Are you the sleep optimizer, maybe worried well, or do you have an underlying sleep condition? Because if you have an underlying sleep condition, these things may not be as beneficial.
Right.
Yeah.
So is there one specific tip that you could leave our audience with concerning sleep?
Yeah, Lynn, I love this question. And for me, it's always prioritize sleep, right? Because when you're well rested, you just feel better. It's easier to go to the grocery store, plan a healthy meal, clean up after yourself. It's easier to get off the couch and go to the gym or take that walk or hang out with your friends. Me personally, when I'm not sleeping well, I see that drive through and man, it's so easy just to go through it, right? It's so much easier just to order food from DoorDash. And typically when you do those things, they're not as healthy. So if you're really interested in overall health and wellness, if you prioritize sleep, it makes it easier to think about your nutrition. It makes it easier to move your body. And, I'm more mindful, with my own health, and just my relationships are better, right? Because sometimes when you don't sleep well, things get on your last nerve a little bit easier, right?
Yeah, absolutely.
Can be a little bit more irritating to those around me. So just being a better parent is, sleeping makes me a better parent. Yeah.
Well, I really appreciate you coming on today, and I believe that you have some goodies for anybody that's listened in today.
Yeah, we have a free checklist. It's just some things that you can consider to talk to your doctor about if you are a woman in midlife suffering from exhaustion. It brings you through talking about, different labs that you can different labs that you can order for yourself, because sometimes we think of thyroid, anemia, vitamin deficiencies, but just a whole host of things, right? Because it's just learning to expand our view and see what's possible, because maybe there are some things that you haven't considered that could be contributing to your sleep.
Yeah, that's great. I'll have all of the links to your free membership that you've got and to your social media. Thank you so much for joining us all the way from sunny California today. And I really appreciate the work that you're doing, because I think it's so necessary. It's just a fraction of what I do in my practice when it comes to sleep. So when you can get in some deeper information, that's so helpful.
Yeah, my pleasure, Lynn. Thanks for connecting with me.
You have been listening to the Living Life Naturally podcast, where we're on a mission to inform, inspire, and encourage women to live their best life confidently, joyfully, and freely from what's been holding them back. For show notes and free resources, visit holistic-healthandwellness.com. And I'd be delighted if you'd follow us on socials to connect further. If you enjoyed this show, why not share it with your friends? If you found good value, chances are they will too. And of course, a 5-star review on iTunes is always greatly appreciated, as much as I appreciate you listening. So until next time, live life naturally and joyfully.